Hello, I am Aaron Patzer. I'm the co-founder and CEO of Vital. Vital does AI-powered patient experience. I am lucky enough to be joined by Mark Slyter, the CEO of Dignity East Valley, and frankly, probably my favorite healthcare CEO. Don't tell the 100 other hospitals that we work with. Thanks for joining us, Mark. You want to give a little background?
Yeah, absolutely. Yeah, I'm CEO of Dignity Health East Valley, which is Greater Phoenix market within Common Spirit Health. I'll talk to you a little bit more about that in a minute. But yeah, but 25 years in the business at multiple levels, hospitals, academic medical centers, and running other health systems. So lots of experience, but really excited to be with you today.
Happy to have this conversation as well. And just to give some background, we started working together just about 3 years ago. I think it was the fall of 2020, full pandemic swing of things. And so it's been an amazing 3 years.
It gave me
Um,
something inspirational to work on during the pandemic.
Thank you. So I'll talk a little bit about what Vital is, and then I want to toss it over to Mark to discuss how it's being used in East Valley. So Vital is AI-powered patient experience. Well, what does that mean? So that is using AI to predict the wait time that you might have in an emergency room. It's using AI to assign patient education to people so that nurses don't have to put together a playlist for everyone and it just tracks your visit along. We use AI to parse your discharge paperwork into a nice 1, 2, 3 step checklist so you know what to do when you're leaving the hospital, which can be exhilarating for leaving the hospital, but also a time of serious confusion about what to do next and how to not end up back in the hospital. And we use AI to actually translate doctors' notes and radiology reports from that kind of medical jargon full of abbreviations and kind of feels like gibberish to non-medical people into something that patients can understand. So we work with you on patient experience in the emergency department for your inpatient stays. We work with your care teams on things like sepsis alerts, patient experience, issues that get escalated and then resolved quickly, and also on follow-up care. So it's a wide array of things that we've been working together on. And so that is a little more on Vital. Do you want to tell us a little bit about how you sit in the larger picture of Common Spirit?
Sure, Aaron. Yeah, Common Spirit's 144 hospitals across 22 states. So one of the largest health systems in the United States. We're focused in on the Arizona and Greater Phoenix market, and we serve more of the east side of the Greater Phoenix market. About a couple of million folks in that market, 6 acute care hospitals, just large footprint, 17 clinics, a couple of specialty hospitals, a couple of rehab hospitals, and several ASCs, freestanding emergency departments. So it's a very comprehensive microsystem within a large health system. Today, we're going to focus in on a couple of the hospitals, our largest hospitals in the market, and really one of them is one of the largest hospitals in Common Spirit Health. And we wanted to apply these types of improvement efforts and technologies and in these settings, and we have been able to do this in other settings as well. But Chandler Regional is a level 1 trauma center, academic medical center, 440 bed hospital, and Mercy Gilbert is a almost a 300 bed hospital, community hospital with about 4,000 employees in between the two of them, and about 1.2 billion in net revenue. So that's a little bit about the areas we'll be talking about today.
I love the scope in which you work. $1.2 billion in net revenue is like you're a Fortune 500 CEO, basically. Even though it may just be a couple of large hospitals, I mean, it's a lot of people and a lot of revenue, which always blows my mind,
Yeah,
coming
it
from the
gives
vendor space.
perspective. It gives
Yeah.
perspective. And most health systems, there's many health systems that are not as large as the market that we're talking about. So it gives a nice perspective.
And in addition to being modest about the scope in which you work, I think you're also quite modest about some of the achievements that you've had in safety and patient experience. And do you want to tell us a little bit about this? Because I think you're like rated, number one or two in all of Common Spirit and a bunch of like national awards as well.
Well, that's
Now's the
because
time you can talk yourself up. I
yeah,
know it's a
well,
whole team
I
and you like
appreciate
vendors
it,
like
Aaron,
us,
but
but
this is a partnership, as you know, and great collaborations with Aaron and his team and many, many others. I thought before we got too far along, we would ground this into, why you should maybe pay attention a little bit here because it does drive 10 times results. In fact, I'm going to share some of the measures here and goals and achievements that hopefully will spark your interest. But Aaron's going to tie it together of the actual performance of the technology and how it has driven some returns. But there's no question about it. This technology and our methods of high reliability have really achieved some amazing results. In safety, we've had over two times in the last 6 years, over 200 days since a serious safety event at our larger hospital and at Mercy Gilbert. For those that are on a high reliability journey or in a high reliability organizations, you know how hard it is to achieve zero harm, which is 365 days since a serious safety event. Mercy Gilbert has achieved that 3 times in the last 6 years. The pacing experience has been absolutely phenomenal in the improvements that we've done in those particular areas. I'll tell you, Chandler Regional was sitting there at the 30th percentile, just consistently underperforming, and Mercy was just very erratic in its performance. And with our technology and our other enhancements in high reliability, those are some of the two best performing hospitals in Common Spirit. Mercy Gilbert's number 2 in the company. Chandler Regional's number 5 in the company at 85th percentile, 90th percentile patient experience results. And quite frankly, we'll talk about this. Aaron will talk about a little bit about this. We have spun that patient experience into Google ratings and other types of things with that linkage to technology. Also into employee engagement, least you not forget that any technology that we put in place, we want to make sure that the work environment is more productive, more efficient for our employees. And the feedback has been just overwhelmingly positive, not only in the culture, but in the technologies that we put in place. And that has placed us number 1 and number 3 in the company in employee engagement of all the 144 hospitals in the company.
that
These are some of the main components, but there's more. There's more.
that is amazing because every other hospital system that I talk to, it's staff satisfaction, it's nurse burnout, it's employees who are not happy. And to have technology and process that actually you can measure, I mean, that's forget about, what Vital is selling, just making life easier for your doctors and nurses, might be one of the best achievements here.
Well, and
But it
and having a technology partner that recognizes that is a critical component of success,
Yeah.
which is very important too.
Now, there's still yet another slide of your team's many accomplishments. I believe that you are CMS 4-star rated. It moved up from 3-star. You've got, top ratings in US News. But the financial thing, all these health systems, they're having billion-dollar losses, and here you are putting up 11 and 12% EBITDA on the board and growing market share in Phoenix, a competitive market. How is
Very good.
that possible?
Well, it's possible because we don't lose track of the fundamentals, and we make sure that safety, quality, patient experience and employee engagement are very strong. And quite frankly, that transitions into good financial performance and growth. We also look at partners that can help us do those types of things. And you'll see later on in this presentation how we have taken, even in selection of our technology partners, how they have helped us improve financial performance, how they have improved our connectivity and referral sources and follow up to improve growth. And quite frankly, we are in a very competitive market, and I know many on that will be watching this are as well. But it's not just because the Phoenix area is growing. We have actually taken market share from very tough competitors, Banner and other large health systems in the market, and we in this last year alone took over 2% market share from our competitors. So it's really good accomplishments with these types of partnerships.
2% is serious in a market like that. 2% market share growth. Now, one of the things when I visit Chandler and Mercy Gilbert is you have a very consistent framework that everybody seems to know.
Yep.
Dignity and common spirit, it's hello human kindness. You hear that a lot. But you have excellence every day, every way. Do you want to talk a little bit about how that framework, informs your whole team before we get into the technology?
Yeah. So I did talk about the high reliability organization and the model that we use and evidence-based practices. We have labeled that, we branded it so that everyone knows when we say that what we're talking about, and we labeled it excellence every day, every way. And it's three main components when we say that. One is focused on behaviors that are consistently delivered. So this is the values of the organization, translating those to standards of behavior to our staff, and just reinforcing that. The second one is the reinforcement piece. You cannot walk around the hospital without understanding that these key behaviors and values are important to us, and these critical competencies and skills are important to us. And so all throughout the hospital, we regularly find ways to promote and reinforce how important those things are. And we also match this to our recognition. So we recognize for those components too. And you will see that on the third component, how we've incorporated those to help promote and recognize into our investments in technology and innovation and other types of enhancements. Let's face it, this was not free. So anyone on the phone that recognizes that if you make these types of commitments, it's not free, but the outcomes, as we shared earlier, are significant and well worth the investment in time, resources, and technology.
Great. And our products, Vital, that's ER Advisor and Care Advisor, go hand in hand with care coaches, care guides, the care model, the care practices. There's a lot of care in your organization. Yeah. And we're going to get into the patient experience platform in the very next slide, but how does technology fit with humans in this model?
I'll tell you, Aaron, this is, I think many that are watching this recognize that the importance of what is the evidence-based best practices to better outcomes. And it's focused around communication, responsiveness, and engagement. So all of our technology partners, all of our process, all of our investment and resources have been focused around enhancing communication, responsiveness, and engagement. So we're going to go into the first one, which is the technology piece, but I will tell you what we're not going to go into is other components that make the technology work even more effectively. And that's this partnership with operations and regular discussions about what kind of resources or processes that need to be handled at the operations level to make sure that we get the most out of the technology and the investment we made there. So care coaches are nothing more than nurses on the floor dedicated to support and round and coach nurses on hourly rounding and other types of things to improve our responsiveness to patients. Care guides are an enhanced discharge phone call contracted service that we've worked with and integrated into our process. Our care model is unit-based hospitalist. So we developed a more robust unit-based hospitalist model that was more responsive to patients. And then our care practices are combinations of things: hourly rounding, huddles, leader rounding, and other types of things that have been proven to support the care that's delivered. And we do that in a care support methodology, which is what some might call service recovery. We've thought through all of the processes, so all of these connect together and can respond back to an alert or a prompt that our technology gives us. They go hand in hand.
Great. So let's talk a little bit about the tech, and this is where we come in. So on the patient experience platform, we have ER Advisor for the ED, and this sits on top of your EHR for Dignity. That's Cerner, but it works on Epic or Allscripts. And it's got a real-time view of everything that's happening for patients. So because it knows everything that's happening in the background, it can really guide patients through what could be one of the worst days of their life. So it's going to tell you what to expect. You're going to be going to triage first, and then you're going to get a room. You're going to be assessed again by a nurse. Here, we use AI to figure out how long you're going to wait. And that setting those expectations is really important for patients to know that it's going to be a 45 to 60-minute wait. And this doesn't have to be dead time. This is time that you can actually use to prepare for making your visit faster. So giving people tips on what to do during that time, whether it's early urine collection or being prepared with your home medications, or actually sharing that visit with family members. We've actually had over 100,000 family members since we started in the East Valley, huge during COVID, share their visit with family. So that parents, if one spouse is at home and a kid is brought into the emergency department, they can track that visit. Or you can let work know where you are, or you can let somebody from across the nation track your visit in a very secure, PHI-free way. And then in the Care Advisor for inpatients, we take that concept even further. So we show all of your test results. We explain what each of those mean in very human terms. I always think it's weird that most hospitals will give you this sheet of paper with lab results. You've got they're like, here's your CBC, and you're like, okay, it should be called blood count, complete blood count, and here are the components. And they're always like, your bun is 26 micrograms per deciliter. And this app treats people like humans. This tests your kidney function or your liver function. This one can tell if you're dehydrated. This one tells if you have an infection. And then, we've been showing these notes to patients that say you have a fracture of your lateral malleolus. And I don't know what a lateral malleolus is or what part of my body that is. And then it'll say, oh, you broke the middle bone in your foot, and to be able to translate that into real patient language. We've got a recovery meter that shows how people are progressing day to day. If you're in the hospital for 3, 4, 5 days, it's hard to know whether you're getting better or not. So almost a dial that shows you how you're doing today versus yesterday. We have service requests. Those are one of the things that fits in with your model, where they really help humans out, where you can request all those maybe lower priority, non-urgent things. You don't need a nurse to come rushing into the room, but you just need a charger for your phone. You need a bottle of water. You might need assistance to the bathroom, not immediately, but in the next half hour. And putting those onto techs or other workers so that nurses are less overloaded is maybe one of the reasons why your nurse experience scores are higher. Absolutely. So that's a little overview of the patient experience platform. And specifically, you have this framework around safety, patient experience, employee engagement, the financial aspects, the growth, the quality. And so I thought we could talk through some of the results that you've been seeing here. I ran the numbers, and just to give people an idea of scope, there are, just in the last 12 months, 200,000 Dignity East Valley patients who have used Vital software. about 40 or 50,000 on inpatient, and what's that leave? 150,000 on the ED. I think the usage is something like 65 or 70% of all patients with a mobile phone number are using this. Um, and uh, One of the reasons why you want patients to really understand their journey is not just so that they complain less or they have better patient experience scores, but it really makes them safer, less likely to readmit. Um, but you need to be able to understand what your discharge instructions are. You need to be able to understand exactly what's wrong with you in plain language. And so, not only does AI support that translation into plain language, but it's multilingual. So it's in Spanish and it's in Vietnamese and it's in Somali, less so for your population and more so for other clients. Um, we do surveys that keep people safe. So, how are you doing in your room? What's your mobility? What are your ins and outs? What can you eat without nausea? And I actually don't know exactly how you quantify um, how much Vitalant specifically has helped on the safety side, but your team put together a couple of stats that maybe you could walk us through: reduction in serious safety events. How much is tech? How much is process? How much is people? How much is training? How do you determine who does what? Or maybe it
Yeah.
doesn't matter.
Well, no, it is a collective combination. So the technology is a prompt or alert. So it has many times it allows us to know about a need sooner than we would otherwise. And then as long as you have that paired with a nice process or a resource like care coaches or others, then you can deliver on a prompt response. And because of that, we have translated that to uh, uh, better outcomes. I mean, you're going to talk about sepsis and other types of things. But in addition to that, we've reduced falls from injury, and all of those types of things that are precursors to a serious safety event. And then combined with our high reliability components, that's allowed us to be much more responsive with the technology. So that's just some examples, but there's many more.
So let's walk through a couple of examples here. Um, Vital might send a survey out, either on patient experience or how was your consult or something like that. We've actually sent surveys out on how much you like the food at Dignity, because you are all interested in improving anything. But one of those patient experience surveys might say, you know what, I'm not having the greatest experience right now. And that you all decided you wanted to escalate that. So if there was a patient issue, it actually goes, I think, to a charge nurse in the ED, or maybe to a nurse
And the care
manager.
and the care coaches. Also, too, you have built-in connectivity direct to feeds. For example, if it's a food need, it goes directly to our food services so that they can respond to that, and it does not intervene on the nurse or take another caregiver to interrupt them. It goes directly to them. Facilities for temperature in the room, or cleanliness for something that needs to be cleaned up from a housekeeping perspective. All of those components have allowed us to be much more efficient and deliver a better patient experience.
I'm glad to hear it.
That raises the level of attention because, like I said, the alerts or prompts just raises the level of attention at the right level. They don't get alert overload, but it raises that attention and allows us to respond more promptly and in some cases not miss some of these diagnoses earlier in the process.
One day I hope we have one of those old tickers where McDonald's had those 5 billion burgers served, but ours is 150 lives saved or 1,000 lives saved. That would be an amazing thing to do, and I think we can do it with a combination of good people and tech.
We're getting there.
Let's talk a little bit about patient engagement, because there are other tools out there, less so for the emergency department, but you have other patient experience tools that have existed for a while on the inpatient. If you're on Epic, you might have a MyChart bedside. There's a Get Well network. There's Sonify P-Care. There's bespoke solutions. And you went with us, I think, in part because we have like really high reachability. Like a lot of patients use this.
Yeah.
What do you think it is? I mean,
Well,
what do you think our secret sauce is coming from
it
that?
really is. Most people are very used to the device, their handheld device, and all of your a lot of your solutions are all built on that handheld device. And we knew that on the front of the end of this, as you mentioned, if we got them engaged on that piece, that they would take it from the most of our patients come through the ER, so they're already engaged using the tool, getting that feedback. And then now they're taking it into the inpatient setting and they forward it on to their loved ones. And now they're engaged on the tool as well. And so all of that creates much better engagement. And some of these
Yeah,
other resources, listen, we have Cerner and a very robust electronic medical record. But if we polled and asked our folks what patients and family members actually get on our EMR, it's in the 10% or less range. It is not good. This tool, because it's so intuitive and it's right there on their device and easy for them to interface with, much higher engagements, as you mentioned. So we wanted to push more of our solutions towards this type of platform. In addition to that, we had Sonify too. Sonify did connect to our electronic medical record and then documented some of the education, but it was pushed through the TV. We still do use some of those components, but we're gravitating more to this type of tool because it helps us stay better connected, and we get more engagement with our patients on their education and other types of components. So that's
yeah.
why we move more in this direction.
One of the things that you just described, I'm a technologist by trade. I didn't mention this at the beginning, but I was the founder of Mint.com. I was the head of product for Intuit, and I've had the fortune to work on products that have been used by a couple 100 million people, TurboTax and QuickBooks and Quicken and Mint. You just described a good funnel optimization, which means when somebody walks into the emergency department, and that's 145 million emergency visits in the US every year. Somebody walks into the emergency department, what's the first question? How long am I going to wait? When am I going to see the doctor?
Yep.
And so you send them a text message. Do you want to know how long you're going to be waiting? Click this link, and that's all you have to do. No download an app. You're like, that's exactly what I want to know. And so it's no wonder you get that kind of use. One of the things that we noticed for inpatient is engagement initially was a little bit harder until we added sharing in there. So
Yep.
family sharing is nice for the ED, that a loved one is progressing through this emergency and keep track of them. But on inpatient, it's almost a little bit different where we noticed that leaving labor and delivery aside, the patient population can be a bit older. And people in their 60s and 70s, about 50% of them will still use Vital. Maybe it's not 60 or 70%, it's about 70% for people in their 20s and 30s. Still high, but sharing with a caregiver or a son or daughter who might be in the room with them turned out to be the key to getting that higher utilization. So family members can actually watch the videos alongside and guide the patient as well. Now, one of the things that is crazy, and all of you at home can do this, if you do a Google search or Google Maps search for Chandler Medical Center emergency room or Mercy Gilbert emergency room in Phoenix, you'll notice that the Google star ratings I think we're up to 4.8.
Yep.
And maybe 4.5 or 4.6 at Mercy Gilbert. Most emergency rooms are 2.1, 2.3. Like you wouldn't eat at a
That's where we
restaurant.
were. That's where we were before the partnership, sure. So
You guys were a little higher. You started out at about a 3.4, 3.5. So you were already a little bit better than most. But you're right. We added 1.5 stars on Google ratings, and I think that's a testament to the responsiveness of your team. These things where people have a complaint and it gets escalated to the charge nurse or the nurse manager. We actually pulled some data on it a couple weeks ago, and it was the pre-survey, the one where you're still in the room and there's still a chance to turn it around, not the HCAPS, not the Press Ganey stuff later. And it was all these 1 and 2 and 3-star reviews. And then your team, because they responded quickly to those complaints, we looked at what was the net promoter score, what was the score on the back end, a couple weeks later when it really counts. And 80% of them were higher.
Yeah. Which doesn't surprise me. Again, coming back to communication, responsiveness, and engagement. Those components drive the overall outcomes and experience. So it's not surprising.
I guess it sounds simple, but you're actually doing it. Somebody's upset. We know about it because we're asking them with technology where they can rant and be a little more honest.
Yep.
And then you respond to it in real life immediately, and the scores improve. Of course they would. People are being heard.
Absolutely. Big benefits.
So let's talk about what we can do for nurses. Nurses seem to be asked for everything. I remember doing some just customer research going into, it was actually Mercy Gilbert is where I did a lot of the user research for our inpatient product. And nurses were being asked to customize food orders, and they were sitting on the phone with food and nutrition, just being like, this guy doesn't want mayo on his turkey sandwich. And I was like, this doesn't seem like the greatest use of nurse, time. And nurses are asked for everything. And all of a sudden we put in these, they're like programmable call buttons. And you could configure them and they could be routed to different departments, food, nutrition, environmental services. One of the things that blew me away is you all put a dog button in there. You can push a button and get a dog visit.
Therapy.
Yeah. I mean, I just thought that was the coolest thing. I was like, I created an app where people can get a dog on demand, and just it's like a life goal right there. But you also added things like a chaplain visit, and somebody that maybe even helped with legal work and things if
financial accounts,
it wasn't
other types of things. And these are things that, just like you had mentioned, Aaron, for most hospitals out there, this is an intervention or a call or something that to the nurse, because the nurse is that one-on-one person with the patient typically, and they have to take out of their nursing duties to do all of those things. We have taken a majority of that out of the nursing components and made it so that it goes directly to the person that the nurse would call and gets her out of that loop.
Yeah. Now, the other thing that, and you all suggested this, and I feel like I want to say you call it the Daisy Award, but when people said, hey, you know what, I'm not having a 1, 2, or 3 star, I'm having like a 5-star day. And you all said, well, why don't you ask them, do they want to recognize a nurse? Put a little write-up in there. And tell us how that's affected your employees and your nurses in particular.
Well, this one is a core component of the overall excellence every day, every way, which is a recognition that saying thank you, recognizing our employees, doing that on a real-time basis or a timely manner is very, very effective. The literature supports that without question, and it's just the right thing to do. So we said, well, they're already in the tool, and we want to make sure that this device can optimize the feedback. And if we could get the recognitions and press the recognition button within that, then we can take that real time. Sometimes that goes straight to the care coach. And while the nurse is on the unit, that care coach can get that, go, hey, that was a great job. I'll probably show you in a minute, maybe some examples of how we take that down to huddles. And we have daily huddles, and we can do some recognitions in those daily huddles, and just allows us much more opportunities to give timely, positive feedback to our caregivers. So it's a real good part. And by the way, Aaron, I have to mention is with your partnership, we meet on a quarterly basis, the steering group, but almost weekly, there is regular interfaces and meetings that just have been absolutely outstanding for our ability as an operations team to be more responsive and the technology to be more responsive. So and this example of recognition is one that we wanted,
Yep.
and your team came up with and really supported us in that. So it goes both ways.
Yeah, I mean, we don't always do everything that you suggest, but you
Yeah,
have ideas like crazy, and we do as many of them as we can, and it's been a wonderful partnership. So, as positive as all of that is, one of the things that we worked on, maybe on the you could call it on the darker side, is and people who are outside of the hospital walls may not see this. Um, Nursing is one of the most dangerous jobs there is. Nurses get yelled at all the time. They get pushed, shoved, assaulted, all of those things. And so this is actually something that we did with you that's still experimental. It's not out for other clients. And this is one of the things that I value. But we actually use natural language processing. It's a type of AI to look for words or phrases or even certain medications, for sedation and whatnot, that might have indicated that like a nurse had a rough time with this patient. And so that can be escalated to a manager just to check up on that nurse and make sure they're doing okay. So it's not only about ensuring that nurses are recognized for the great things they do, but it's also make taking care of them, you
yeah.
know, like you would your family member or friend when something didn't go well.
Creating that safe environment. Listen, you're right. We're in level one trauma, very busy hospitals, and I will tell you that unfortunately that does happen. You get some behavioral health patients and others mixed in there that are really challenging at times. And so anything that would help facilitate or help us de-escalate a situation is very positive. And I was very appreciative that those are the types of things you're thinking about incorporating as well.
Yeah, still a work in progress, but it's part of the work that we do together. Now, back to the positive. Let's take a look at some of the feedback that's used in huddles. Maybe you could read a couple of these off for anybody who just happens to be listening to this as opposed to watching the
Well,
slides.
Aaron, we get these daily,
Yeah,
and we can bring these back to the hub. But these are just a few examples. All the nurses and doctors have taken great care of me and done a great job, and the communication has been strong. Those are the types of things we hear. The ER doctor and nurse were fantastic. They were, we like most hospitals have to move folks around. Sometimes we can't get them a bed immediately, and they're in the ER for a while, or they're in observation for a while before we're able to get them a bed. This one had a great experience in all of those locations, that consistency. And then when we talk about recognition, Olympia, one of the nurses was recognized. So that
yeah,
recognition goes directly to our recognition system and allows us to give Olympia more specific recognition. And then just feedback about the app itself. It's amazing. It's great to receive updates. I will bet that most people that are using their EMRs and other tools, that they just don't have people in it enough and engaged in it enough to give them these types of positive
yeah.
results and engagement from patients and families.
Love that. And it's worth mentioning, on the comment that is about, I was moved around to a couple of rooms as you have to do. Um, ER advisor and care advisor are integrated, so it's one seamless experience. It's a mobile web app. You don't have to download anything, and so it'll say, okay, you're in the waiting room, and now you're in this room, and you're being held for observation. This can last anywhere from a couple hours to up to 12, and here's why, and here's what the doctor's looking for, and then now you're going to be admitted into inpatient potentially, and just guiding people that whole way. I like to think of us as a bit of a nurse backup, so that if you forgot what the nurse said or what doctor said, there is something that you can read and remember exactly where you are and what you're supposed to do next.
You're exactly right, Aaron. And the device goes with them. We don't have TVs in all the room. We don't have all the
That's right,
different things in all these different areas. The device is there to have that level of consistency no matter where they are in the hospital.
because it's their device. Yeah, you're right. One of the places that those service requests have been really valuable is hall spots. If you ever get so overcrowded that you have to use a hall spot, those don't have call buttons. People can feel very neglected, like, oh my gosh, I didn't get a room. Is anyone paying attention to me? Yeah, they're still paying attention to you. And if you need to get a hold of somebody, you push this button in the app instead.
Yeah. Hey, listen, there's many hospital leaders out there that share that type of capacity issues, particularly during our surge times of the year. And yes, they're in hallways and other areas. If they have the device goes with them and they can still interact.
And all of this has led to growth. Now, we can edit this out later if you don't want it publicly in there, but your team did this analysis that the sort of baseline number of follow-ups that you might have had post-ED, post-inpatient that come back into the Dignity system, that don't go look on ZocDoc or ignore their discharge instructions and sort of leak elsewhere or maybe even to a competitor. The baseline is maybe 30% of people will follow up, and then with Vital, it's maybe 37%, so sort of a 7% lift, and that lift, that difference off of the baseline, you calculated just for these two hospitals was worth something like $1.4 million in immediate clinic charges, like the next visit. But you actually went even deeper and said, well, of the 7,000 patients that you wouldn't have had without Vital, about 1,400 of them were high value patients, your ortho patients, your cardiac, your neurology patients. And you told me a staggering number, 36 million in downstream revenue and a couple million in profit just from, in some sense, the people we helped you save.
Yeah, listen, let's face it, those outcomes for those patients are much better. We could talk about this from a safety, patient experience, a quality, but this too, because we're able to capture those patients and make sure they get the care that they're needed, it is financially beneficial to us and health systems that might go down this path. These people need this care, and it's better if the care is connected to this overall environment that we're talking about.
And again, the results for East Valley are so outstanding, and I love that we are your technology partner. I love the amount of credit that you give us. Sometimes I wonder if it's too much, but you've gained a 2% market share versus Banner and a bunch of other people in your space. Like,
this is reputation. This is reputation, and I will tell you, it's directly connected to the overall experience. I mean, when you have the ability to communicate and respond to patients more effectively and engage not only the patient, but their family members, and the technology tool that we partner with does all of those components and enhances all of those abilities, it has an enhanced the reputation. And I will tell you that not only are we growing overall as a market and population, but we are transitioning market share because our reputation is getting so much stronger in all of those different areas that we talked about.
That's a perfect lead into this reputation management. Before, okay, I guess you were 2.5 or 2.6 stars, and this screenshot must be from a month ago or two. It's 4.7. I looked today; it was 4.8 stars on Google. And this is the public reputation, because the public doesn't know about HCAHPS and Press Ganey, and they're not looking at that stuff. That's an internal sort of metric, or for other hospital comparison. But this is what people look at, and you just wouldn't go to a hospital, or you wouldn't go to a restaurant that had a 2.1 star rating. But why do we expect people to go to a hospital that does? So you're right. You've got some of the best in the nation now.
And listen, we still get a lot of walk-ins, people that have choices. And so if you don't think that they are looking at these types of metrics, you're kidding yourselves. And a lot of times they're making decisions almost solely based on these. So you want to make sure that this is very strong, very strong.
Great. And I think the last topic that we had was uh, from a quality perspective, but also maybe we should talk a little bit about from an integration perspective. We sometimes get pushback from systems. Hey, we've got MyChart, we've got a patient portal, and you do. I think earlier in the talk you said that it was probably less than 10% of patients that were sort of actively using that portal to look up their results, whereas we have maybe 60% usage, over 5 times higher. The other thing that I'll point out is we try to play well with your existing ecosystem. So, had the team pull some numbers. We've sent over 50,000 East Valley patients to connect into your patient portal. So, I like to say that an emergency visit is not the time to get people to download an app, create another username and password. That's why we use this special smart secure link instead. It's much easier. But at the end of your visit, it's really nice to hand them off to technology that you've already invested, potentially millions into. So we work well with your patient portal. We've also, improved a couple of other metrics. You're left without being seen wasn't too bad, but that looks like it's decreased. And on the inpatient side, and this is one of the things that I haven't actually had a chance to deep dive on, my team and yours presented some data that the average length of stay, like I can't remember whether it was a 12% decrease at Mercy Gilbert and a 23 at Chandler or vice versa, for inpatient length of stay is actually decreasing because the patient experience is better, people are more informed, nursing is better, all of the above. I mean, that is an insane result.
Well, I hate to say it, sound like a broken record, but if all of the things are focusing on better communication, more timely communication, being responsive to their needs,
Yeah.
clinical needs, and then engaging them, that does translate to better results in many of these areas. But most recently, what we've looked at was the length of stay. So, are we actively trying to get more patients engaged in Care Advisor or this tool that Vital has provided? Absolutely, because we know that produces better results.
And so I think we've got a few key takeaways that we've hit on, that we've gone over a few times for anybody who wants to take a little screenshot. But the one in the far right corner that I just really agree with, and it really comes out in everything that you're saying, Mark, is everyone thinks about the patient experience. Everyone thinks about patient first. Everyone in your organization seems to realize that patient experience actually improves all of your metrics, your staff engagement, your length of stay, your left without being seen, your follow-up rate, your Google ratings. All of these things can be affected through patient experience. Why is it that so few hospitals seem to really invest in patient experience? Almost everybody that I talk to is we need more surgeries. Don't pay attention to the emergency department. That's a loss leader. Why do you think there's such a sentiment that's not patient experience forward?
Well, because it's the most difficult in a very complex health system and experience and continuing. It's the most toughest area to perform better and then consistently maintain that level of performance. That's why when we went after this piece on overall performance, we recognized this is behaviors consistently delivered. This is making sure you're always reinforcing and recognizing and promoting, and you make sure that whatever you're investing in, whether it be people, process, or technology, it's focused in on the right things. And that's the communication responsiveness and the engagement pieces. I will say this too, and Aaron, I know you didn't mention this, but I am going to mention this, and that
Okay.
is whether you invest. The question sometimes I get is, well, I've got an EMR or I've got IT that takes care of this stuff. If you feel like that they just are very responsive to you and are innovative and are really working, and they're just not. Let's be honest. Most of the hospital folks in here will say that IT are stable and they're serving, the primary functions, your electronic medical record, your revenue cycle software and IT systems and other types of things. But when you really want to innovate and get something that's kind of leading edge, it's very difficult to get our IT partners to even have the resources and capability to do that. I will tell you what we did with Vital is first and foremost, we developed the interface piece. Once you get past the interface piece, you can unleash a partner like Vital. And remember what they do. They get up every day and think about what better experience could I provide in this partnership. And we get up and when we meet with them, we think, oh, how can I tie the best operational pieces to make that type of technology that better experience for the patient as well. So I do want to say, maybe some people can do this internally. We have found that it's much, much better to do this with an innovative partner like Vital and keep our IT team focused in on the fundamentals.
Wow. Thank you, Mark.
Well, it's I thought it was important to mention because that is one of the differences, and one of the differences of why we've been able to do this in 3 years and not 10 years.
Yeah.
So,
And you're right. We do think about the patient all day, every day. Um, my evenings and weekends, I'm like, is this the product that I want to use myself? Is this the kind of product that I want my mom, if she goes to the hospital, to use, or my brother or my sister or someone that I really care about? And there are other companies that are doing the revenue cycle management and everything, and I never thought that it would produce the financial results that it has, and it's amazing, and it's a great sort of secondary result, but the first one really is the patients and the nurses who care for them.
absolutely.
Thank you so much for your time.
Yes, sir.
I really tremendously appreciate this. You've been such a wonderful partner, and now a great webinar co-host to add to the mix in our relationship. I
Well, thank
appreciate
you,
it.
and I appreciate it.